I'd like to begin by thanking all of our panelists, Lisa Asari, Dr. Natalie Edmond, Ryan Haygood, and Gwendolyn Kroll for leading tonight's discussion. As our country has navigated the COVID-19 pandemic this year, we have begun to address a second pandemic that has always existed: systemic racism. We know that disparities in healthcare have worsened and that communities of color are overrepresented in many occupations within frontline industries. Additionally, hate crimes have gone up over the last year, including right here in our own Mercer County. We need to acknowledge that many communities of color are feeling fear and anxiety while simply living their daily lives. I am grateful that we have the opportunity to discuss these difficult, interconnected issues tonight, because that's how we begin to dismantle them. I hope tonight will inspire and empower you to take a stand against racism. I am proud to introduce Representative Bonnie Watson Coleman, who was kind enough to open tonight's event for us.
Haley, it's muted.
Hello, YWCA Princeton. I'm Congresswoman Bonnie Watson Coleman, proudly serving New Jersey's 12th Congressional District. I'm very sorry I could not join your panel today, but I am glad to join you in the continued call for advocacy and action to stand against racism in all of its forms. Without question, systemic racism has plagued minority communities for generations, and the impacts are very much present in today's society. One of the most glaring examples of inequality is the impact of racism in our healthcare system. The unique challenges of the pandemic have only magnified the public health crisis that persists and impacts every stage of life for some of our most vulnerable populations. The African American community, particularly Black women, are especially vulnerable to destructive impacts of racism and bias and discrimination in health and well-being care. The issue of maternal mortality in America is particularly problematic. The US has a shameful first place ranking as having the highest rates of maternal mortality in the developed world, with Black mothers leading those numbers. Black mothers are 3 times more likely to die from pregnancy-related issues than white mothers. Infant mortality is also directly related. Black infants are twice as likely to die as white infants. And it is no surprise that systemic racism in healthcare has a critical role to play in these outcomes. Black women should not have to die to give life. Black pain should not be ignored, and Black lives should be valued and protected. In 2016, I was proud to be a co-founder and continue my role as co-chair of the Congressional Caucus on Black Women and Girls. Considering the many barriers and challenges that Black women and girls face in America, it was overwhelmingly imperative that a concerted effort was created to address their specific needs of opportunity, equality, and justice. In addition to addressing the need for change in approaches to the physical health of minority communities, it has become especially important to address the ongoing mental health needs as well. The impact of pervasive racism has had a devastating impact on our communities and our families and on ourselves and also our children. In Congress, I became more aware and very adamant about the needs to address the mental health needs concerning our young people. In 2019, I lobbied for the creation of the Congressional Black Caucus's Emergency Task Force on Black Youth Suicide and Mental Health. It included a working group of researchers, psychologists, therapists, social workers, and educators. What we found was disturbing. It was shocking and it's staggering. While overall suicides among youth have declined, Black youth, especially young children. Suicide is on the rise. There are several reasons for these disparities, but one stood out among the rest: a lack of access to mental health care in the Black community. Hearing these statistics was heartbreaking, and we knew that something needed to change. So I'm proud to say that I've introduced the Pursuing Equity in Mental Health Act with my friend and colleague, Congressman John Katko of New York's 24th District, to invest $1 billion in programs to provide access to mental health care for underserved communities and to train a new generation of minority psychiatrists with the cultural competency necessary to treat them. Now, access to mental health care is just one aspect of solving this problem. It's aimed at healing the wounds, not preventing them. In all aspects of healthcare, I know, as well as I'm sure you all are aware, we need more than words, research, and reports. We need action. We need change, and we need it now. Racism is a serious threat to public health, but I have hope that change is going to come. Advocates like yourselves are critical change agents in our journey to a better tomorrow. I believe in you. I believe in our young people who are problem solvers and visionaries. I believe in our work in Congress. And I believe that we have an administration now that recognizes the barriers of systemic racism and is ready to make change for a better America. Let's continue to work together to turn our declarations into real change in our stand against racism. I know you will have an excellent panel on this topic. Thank you to Jen Johnson for inviting me to speak this evening, and God bless you all.
Thank you to Representative Watson Coleman and her staff for providing such a thoughtful opening to our larger discussion. Please give a warm welcome to our moderators for this evening, Layla Wilson and Melanie Lowe Hoffman, both dedicated members of the YWCA Princeton's Board of Directors.
Thank you, Tay, and hello, everyone, and thank you for joining us tonight. My name is Layla Sharif Wilson, and I am the Manager of Organizational Initiatives and Planning at Centurion in Princeton. Our organization is focused on freeing the innocent in prison. I'm also on the board, as Tay has said, and I joined the board in 2019. Tonight, I will be joined by Melanie, and we will be posing questions to our panelists for the next 40 minutes. If you have a question while we're having this dialogue, please feel free to share it in the chat. We will, ensure that most of your questions get presented to our panelists during the Q&A portion later this evening. Following the panel, we will be going into breakout rooms, which are smaller groups. You will have a facilitator. They have been given two very important questions that we would like you to discuss to continue this conversation and share your thoughts. After that, we'll come back and we will have the Q&A portion. And our panelists will give us two things to take away this evening. They will be action items, just as Congressman Bonnie Watson Coleman stated. We are not just here to stand, but we want to also move and promote change. And with that, I welcome Melanie.
Hi, everyone. Good evening. Thank you, Layla. Welcome, everyone, to tonight's event. My name is Melanie Lowe Hoffman, and I am an instructor and an advisor at Rutgers and Yeshiva universities. I have been on the board of directors for going on 4 years now. I am thrilled to introduce our first two panelists, both of whom were recently honored at the YWCA Tribute to Women Awards for their impactful work. As I'm reading, please feel free to use the chat or Zoom reaction emojis to welcome our panelists. Lisa Asari is the Assistant Commissioner of the Division of Family Health Services in New Jersey, Department of Health. She has worked for the department for 22 years. She oversees 3 service units which provide extensive public health services to New Jersey families, promoting and protecting health. They include maternal and child health, Special Child Health and Early Intervention Services, and the State WIC program. Welcome, Lisa, and thank you for being here tonight. Dr. Natalie Edmond is a licensed clinical psychologist and experienced yoga teacher who takes an integrative perspective to her consultations and trainings. She is the owner and director of Mindful and Multicultural Counseling and believes that transformation happens when we integrate mind, body, spirit, and have an embodied dialogue. She is trained in multiculturalism and intersectional feminism and takes a trauma-informed approach to her work. Welcome, Dr. Natalie. We're thrilled to have you here with us.
Please join me in welcoming Ryan Haygood. He is a nationally respected civil rights lawyer. As president and CEO of the New Jersey Institute for Social Justice, he leads a majority women of color team of racial justice advocates. Their cutting-edge work, powered by grassroots organizing, research, writing, policy and legislative advocacy, and litigation, seeks to build reparative systems that create wealth, justice, and power for Black, Latinx, and other people of color in New Jersey. Thank you for joining us, Ryan. Our final panelist is Gwendolyn Kroll, the Vulnerable Population Outreach Coordinator for the Princeton Department of Health. Her role is to assess, mitigate, and respond to the social and health impacts of COVID-19 on an at-risk population in Princeton. Through targeted outreach to Princeton's most vulnerable individuals, her goal is to navigate the pandemic more equitably and ensure that all residents receive appropriate care and resources. Thank you for being here with us tonight, Gwen. So we're going to start off with some questions. Thank you all again for being here, and thanks to our panelists. My first question that I'm going to present is, how does racism breed into the system in your area of work? How does it prevent the advancement of the people for whom you are working for?
I would say that as a psychologist for many years in Mercer County, for many years I was a director of a women's trauma program. And what I noticed is very similar to what Resmaa Menakem says, which is this idea that simply being born in a Black or brown body is a traumatic event. So before setting foot, before redlining, before experiencing all the disparities, just being born into the body, right, of a brown or Black person. And so with that, it's how does the world interact with you? How does the world show you your worth, your value, starting from the care you get from the very beginning of your life, how you're perceived in school, the ways in which you're encouraged or pushed out, all the ways in which perhaps your needs are not met and heard, and what does that do to your mental health, to your self-esteem? What does that do to your caregivers who are stressed, who are not getting the right amount of resources or respect? What does it take to notice the many Black and brown people who are incarcerated or who are killed? And all of that has this intergenerational impact, right? And so thinking about all the different ways that people cope with trauma, right? The ways in which it creates panic attacks and depression and anxiety and suicidality and aggression, and shortens people's lives. So I see that every day. And then I see just the stigma of accessing mental health care, regardless of your race, ethnicity. But then on top of that, when so much of the therapeutic models are based on white bodies and Eurocentric ideas that don't really affirm the culture and values and lived experiences of BIPOC individuals. So that is just a hint of just, it's so devastating and so insidious. And so many of our therapy providers aren't even trained in that kind of cultural competence to really be able to tailor treatment in a way that's really welcoming.
Thank you. Thank you.
I would just add on to that from a maternal child health perspective. Dr. Natalie, you really hit on many of the points that I was thinking about. The Representative Watson Coleman talked a lot about the disparities that we see in maternal and child health. And I would say from a public health or health perspective, those early days, the start can really determine what happens over the life course. We have something called the life course model. And we often hear that, you judge a society or system on the way that it treats its mothers and children. And when we look at some of the stats that we have in the United States of America, as she mentioned, we are worst in terms of maternal mortality and infant mortality amongst developed nations. In New Jersey, she gave you national statistics. In New Jersey, a Black woman is 7 times more likely to die from pregnancy-related complications, and a Black infant is 3 times less likely to make it to its first birthday. That is right here in the Garden State. That is in our backyards. And this is once you even control for socioeconomic status. So we can go as far as saying that a Black woman with a college degree can have worse outcomes than a white woman with a high school degree. So the education and the income doesn't necessarily give you the insulation or the protection that we would expect it to have because of things like racism, because of stress, because of structural inequities and inequalities. And so I think that really bleeds into our work. It really impacts the way that you start. And so I feel like in my work, it really is difficult because we're not all starting from the same place. And as Dr. Natalie said, there's generations and generations of this that we really have to unpack and unravel.
Thank you. Thank you both for speaking on the physical and mental impact of racism. I am going to ask Ryan if he can give his perspective and input on it, because he will be bringing us a different idea of how it would impact your livelihood and socially, how these racism impacts lives.
Sure, Layla, thanks for the opportunity to join you, and thanks for hosting this conversations at such a critical time, YWCA. I prepared a couple of slides, which I think really go along nicely with what Lisa just shared. And it talks about this way in which we are. So you see this first slide is a young man. I love that Lisa just lifted this up. This is obviously a young man who's standing on the foundation. And the foundation you see is cracked. And we think a lot about how that foundation and those cracks are cracks of structural racism. And particularly now in the throes of the coronavirus pandemic and the police brutality pandemic, the broader structural racism pandemic, those cracks are causing real earthquakes in Black communities and other communities of color. And as you see, Jen, if you would advance to the next slide, you'll see that this is really, we see this happening in the area of police brutality. Obviously this week, thinking a lot about how legal justice was served for Mr. George Floyd, but of course, actual justice would mean that he would still be here, right? Actual justice would mean that policing would be a profession that has accountability built into it so that we would stop seeing the harm against Black bodies from city to city and state to state. And this next slide, thanks Jen for advancing to it. This is really a jarring graphic. Dr. King talked about how you don't have to see the whole staircase, just take the first step. And my colleague, Jake at the Institute here where I work, produced this really striking visual that captures a lot of the work that we do around racial disparities. And so here again, you'll see this young Black boy and he's looking up at this staircase. And of course, stairs are sort of an appropriate metaphor for life. Each of us, right, has to climb stairs as sort of an indication of how we overcome adversity. But to Lisa's point, for Black people in New Jersey, the stairs are especially steep. And I'll just share a couple of these numbers. These are numbers, honestly, you all, they keep me up at night often, because although people think a lot about New Jersey as being a very progressive state, and in some ways it is, and a very richly diverse state, and indeed in many ways it is, it's also a state where this incredible prosperity exists along some really punishing poverty, where the racial diversity also exists along some of the most grinding racial segregation in the country. And so if you'll go with me up to the middle, specific to this young Black boy that Lisa talked about, young Black kids, you'll see 21 to 1. A 21 to 1 is the Black to white youth incarceration disparity rate. What that means differently, right, or differently put, is that a Black child in New Jersey is 21 times more likely to be in prison than a white child. That's the highest racial disparity in the country, even though Black and white kids commit most offenses at about the same rate. That racial disparity doesn't reflect actual participation in crime. What it actually reflects is a very different systemic response to Black kids when they do things versus when white kids do things that may run afoul of the law, which is why today in New Jersey, there are 8 white kids in prison, whole state, 8, sub 10. The rest are Black and brown. I'm not advocating, obviously, to incarcerate more white kids, but what I am suggesting is a very different response when white kids commit criminal offenses than when Black and brown kids do. Another quick data point, if you come down to the second step, you'll see on the right side, $179. Now this number, I'm gonna just spend a little second on it because this one, you can miss it because it's such a jarring number. My colleague, Laura Sullivan, who leads our economic justice work, through some original research and writing, came up with this data point. This is wealth. So in New Jersey, again, one of the wealthiest states in the country, the median net wealth for individual Black and Latina adults is $179, less than the cost of a laptop. The individual median net wealth of Black adults and Latinx adults is $179 versus $106,000 for the individual net wealth of white adults in New Jersey. And we can talk more about what that emanates from, but I will tell you that that is not a reflection of individual failures, but instead a reflection of systemic racism that's rooted in slavery in New Jersey. And then I just share these last 2 pictures. I always tell this story to make this real. Thanks, Jen, for moving to this slide. So this is a photo. This is my wife with the A on her shirt. That stands for Avon Avenue School. She's the principal of that district school here in Newark. She's surrounded by her team. And you'll notice that there are some computers on the floor. That's 125 computers. This is back in March of 2020, at the beginning of the coronavirus pandemic. It was then that the superintendent of the Newark Public Schools, like most superintendents across the country, urged administrators to quickly dispatch all computers in the school to the homes so that the scholars could learn at home online. And so my wife, Charity, and her team did that quickly, and they were able to get 1 computer to every family. But what they found is that they didn't have enough computers for those families that had multiple scholars. And so there's a gentleman, his name is Michael Rowe. He hosts a nationally syndicated show called Returning the Favor. He learned about how Charity and her team were delivering computers to their scholars' homes, and he gifted them $25,000. Really incredible act of generosity to go along with the heroism of Charity and her team. And they were able to buy those computers and deliver them to each kid, almost 600 kids in their school. So there was now a 1-to-1 computer to kid ratio. Last slide here is, these are 2 of her students. And if she were here, she would tell you there are a lot of takeaways from this photo, right? This is 2020, right? This is March of 2020. There are a lot of takeaways in this photo, to Lisa's point about how we treat kids, a lot of takeaways. But what she would tell you to focus on is the ingenuity of these 2 young boys who received these computers, because shortly after they and so many other kids got computers, they weren't able to access them because they didn't have, of course, internet access. So these boys, they moved their computers to the windowsill, which they're using as a desk, to borrow one of their neighbors' Wi-Fi, right? So they could learn online at home. And the reason I share this is because this picture is such a clear example of Lisa's point, how we do not value the life of Black people in the way that we value the lives of other people. And this is such a clear example that in New Jersey right now, last point, back to the youth incarceration issue. New Jersey spends right now $445,000 to incarcerate each of its young people. Can you all imagine what you could do were you to have at your disposal nearly $500,000 to invest in the folks you work with, the young people you work with? But we make those very deep investments incarcerating young Black and brown boys in particular, and not in building the kinds of systems that would empower those two young boys and so many other kids across New Jersey. And part of this conversation tonight is, so how do we repair that harm? And thanks for bringing me to the conversation, Leyland. Thanks for the generous introduction.
Thank you, Ryan, for that overview. And, you know, it segues perfectly into asking Gwen. You know, Ryan just provided us a thorough overview of the deep impact of racism in the state of New Jersey. You're working in the municipality of Princeton. Can you talk a little bit about what racism looks like within Princeton?
Hi, so thank you for inviting me. And thank you for inviting me to talk on this subject. So in Princeton, so I'm an outreach coordinator, specifically during the COVID-19 pandemic. So I'm speaking to community organizations, and I'm speaking to individuals themselves through my outreach. And I'm seeing through the pandemic racism in the differences in health outcomes for the different racial and ethnic groups, of course, on a national level, but also locally here in Princeton. And there'll be a stat sheet that will be shared after the panel where people can see the statistics that we see in Princeton here. And definitely I like what Ryan said before about looking at the numbers, but looking kind of more at the context. So the numbers that he presented, it wasn't based on individual failures for why they had lower wealth. And looking at the data and statistics for Black and brown people dying more from COVID-19 and getting more extreme cases from it, it's not because of an intrinsic or biological issue that makes them have this worse outcome. It's because of, you know, the institutional racism that we see in the living conditions, employment options, access to healthcare, mistrust, and also just not feeling comfortable with healthcare providers that prevents communities of color and people from having more positive health outcomes compared to their white neighbors. So that's what we see in Princeton. And, you know, events like this pandemic, they emphasize these disparities that have been long existing, but now there's more light that's shed on them. And then we see these disproportions in the COVID-19 case, hospitalization, and mortality rates. And this is really preventing Princeton residents of color from, you know, living if they are barely surviving compared to their neighbors. And because of these systems in place that we have to prevent them from succeeding. And then, you know, this can affect families. And then we see the generational outcomes from this being passed down.
Thank you, Gwen. Thank you all to all the panelists for answering that first round of questions. So our second question focuses more on what would it mean for your work and the community that you serve if racism is formally labeled as a public health crisis. What would your work look like, and how would it change? Who would you want to be involved?
Thanks for that question, Melanie. I'll take a stab at that. I think a declaration of racism as a public health crisis would mean a lot to me and the work that I do. And why is that so? Because I think sometimes it can be confusing. Sometimes in health, for instance, people will talk about behaviors, pre-existing conditions, all kinds of things that may lead to poor health outcomes. But in actual fact, it is sometimes a system that has contributed to many of those inequities. And so if you are, for instance, as Ryan beautifully showed us in the picture, in a neighborhood where you don't have Wi-Fi access, or in housing that is not ideal, or in neighborhood without parks, without grocery stores, without safe places to walk, you are a product of that environment. And people may often think that, oh, you just didn't want to live in a certain place, or you don't want to do the right thing. But it is, you are the product of a system and a structure that does not value you. And so I think it's important to talk about racism, structural racism. And I think on the flip side, by declaring it as a public health emergency, we're also saying this is a priority. When we prioritize things, we take action and we bring resources to really attend and address them. And so I would say a lot of the work that we see in the health sphere is around health equity, about eliminating racial disparities, about doing anti-racism training. And all of that comes to being and comes to light when we are bold enough, courageous enough to really call out racism for what it is.
I would just add that I think what it would do was create some urgency around responding to the challenges we face. So I think about it in the context of a snowstorm or other bad weather, that when there's a state of emergency declared, then there are additional resources dispatched and additional precautions and responses made available. So in this moment, when we think about the killing of Mr. George Floyd, states across the country are looking at their policing practices. And there's been some encouraging signs that states are taking affirmative steps to really respond urgently. There are other reports that some elected officials are treating that decision as a reason to let their foot off the gas, as a sign of relief. And I think, on that issue and many others for us here in New Jersey, I think it's important to treat it as a cautionary tale, to move with the kind of urgency that's required to protect against those kinds of things happening here in New Jersey. I think declaring racism a sort of a state of emergency or a public health crisis, I think would begin to marshal kinds of urgency and resources that we really need to address it.
Thank you.
I would just also add just the idea that in the psychiatry, mental health field, there's diagnostic codes of things that medical professionals have deemed as this is a legitimate, validated diagnosis that allows you to use your insurance to access healthcare. And there is not a diagnosis related to racial trauma or anything that specifically says that racism is the cause for your mental or physical health issue. And so for that to be validated, to actually be a diagnostic code, I think would say a lot and affirm lived experiences of so many people.
And I think going off of that validation and having that validation for communities as a whole, for them to be able to speak up if they have been dismissed in the past for experiencing racism in public health, and also just being able to tell their experiences if they haven't felt comfortable before, and telling them within their communities, especially if there wasn't a public acknowledgement or public stance of racism in public health as a whole. And bring this back to Princeton. In Princeton, it's not super diverse. However, we do have residents of color who live here who need to be recognized. So if they see this public stance, then they might feel more comfortable, sharing their experiences and holding institutions and organizations accountable to look at this public stance and, take action within the municipality and then community organizations as a whole.
Thank you. It's interesting that you guys, over the course of the first question and then this question, there's this word that I've heard over and over of response. Initially, it was the response to who you are in a Black and brown body that is negative. And to counter that, to sort of change it and make things new and move into a better direction, there needs to be this emergency response to correct it. And so what I would like to ask you guys is, you've talked about how this question was about how it would change your sector or how it would change your work if racism is declared a public health crisis. Well, it has been. But what other disciplines, what other sectors would you consider working with or think are very important to bring into this to make a more global change?
I'll start by just saying I love the panel. I think the panel is pretty diverse. We come from different sectors, right? But we're talking about an issue that is so cross-cutting. I can't do my work effectively if the work in Ryan's field isn't happening well. And I can't do my work well unless the mental health needs that Dr. Natalie covers are sort of addressed in the root causes. And like she said, the diagnostic codes established and all of that. And so what I say is we need seats at every table. I need to get to Ryan's table and he needs to get to mine, because our strategies and our work is complementary. You know, those kids have healthcare needs, but they have educational needs, they have career development needs, they have mental health needs, they have food needs, recreational needs, all of that. So I guess the person is a whole person. And so there is not a single sector that cannot be in this conversation, I guess is what I would say. So I love the panel because I'm learning about education and income and incarceration rates, but I know health. But all of this work is complementary. And so I would just say, you know, kudos, thank you, YWCA, you know, thank you, panel organizers, for bringing a diverse group of folks together to talk about an issue that impacts each and every one of us.
I love that. Yeah, I've learned so much just being on this panel and thinking about how it's such a good model for what people can do in their communities, right? That if people come together who have different talents, different connections, and they care about lifting up the lives of the most vulnerable, and they decide to do whatever they're going to do, that matters in the community. And if every community had people coming together across disciplines, right, that would be really powerful, because that's what we need in all the communities, because these things are not just happening in one town or another town, they're happening in almost every single town. And that we really need outrage and a sense of, would I want this for my family? Would I want these statistics to be impacting my family? And so for us to think about the liberation and the justice for every single being, especially the most vulnerable.
Thank you. And I would like to move into a question. We have talked about the struggles. We want to know, what is your greatest struggle in the work that you do in relation to this topic? But also, we would like you to share any recent wins or any wins that you have encountered that relate to racism, that relate to this as a public health crisis, because we want to feel encouraged. We know there's been some, so we would like you to also share that with us.
So I would say that my biggest struggle in local health here in Princeton, definitely in the COVID-19 realm, would be ensuring equitable vaccine distribution locally. And obviously that's a huge topic right now, because the vaccine is the greatest COVID-19 prevention method, and it will save lives. So, and this is really a two-part concern, I would say. So it's going about effective communication and making sure that we are actually reaching communities of color, and that whatever communication posts, anything that we go out there, it's not just being overlooked, or just making sure it's reaching the right people. And then also maintaining trust in the vaccine and the providers of it, or if there isn't trust already, then creating it. And that's really where community partners come in play. And then that goes into one of our most recent wins. So the Princeton Health Department, we've been able to host local clinics again regularly, which have been great. And the local clinic is great because we're able to provide, more comfortable space, a space that's at home to vaccinate, where residents can see people that they know also getting vaccinated, and those who are vaccinating them might be familiar faces, especially when we have our clinics in different locations, like we've been doing them in housing units. Princeton Senior Resource Center will be having one at the YMCA next week. So kind of moving that along, and through targeted outreach and also coordinating with community leaders and just community organizations as a whole to talk with their members. We've been able to connect to individuals and build trust in the vaccine and providers and educate through the trust that is already built with these community partners, with these with the individuals who are part of these organizations and communities. And then from there, we can actually get shots in arms and save lives, prevent COVID-19. And from our clinics, we've seen a general upwards trend in the recipients of color at our local clinics. And this trend is super crucial because it is recommended by public health experts to vaccinate those who are impacted most by COVID-19. And we're seeing that locally and nationally, that those impacted most are those of communities of color, people of color, and also lower income, elderly. And so since this is the best way to prevent people from dying from COVID-19, that's what we're doing locally in Princeton.
Yeah, I can offer a quick word there, Layla. So, our work, we try to concretize our advocacy and policy change, and very often it happens legislatively. And so I offer this because this is to your point, Layla, it's an encouraging story. And then I'll talk about a challenge behind it. So I'll lead with the encouraging piece, then offer up a challenge. So we sort of proceed with the belief that the racial disparities we see today in the modern era are rooted in history in New Jersey. So one of our areas is around democracy and justice, where we try to expand democracy. Our goal is to make New Jersey the most inclusive democracy in the country. And a couple of years ago, we were beginning to really realize the way in which the law that prohibited people with criminal convictions from voting really served to suppress turnout. So we would do voter registration drives, and we would hear folks say, well, I love to register to vote, but I can't because I have a criminal conviction. And so we began to do some research to understand, well, where did that law come from in New Jersey? And we learned that in 1844, New Jersey did two things. One, it restricted the right to vote to white men only, 1844. And in that same year, it denied the right to vote to people with criminal convictions. And so 2 years ago, about 100,000 people couldn't vote because they had criminal convictions, and half of them were Black. And the reason is because we connect voting to our criminal justice system. And of course, as I shared earlier, we have some of the worst racial disparities in our incarceration system. And so we launched a campaign. It was called 1844 No More, right? Let us vote. And the goal was to turn a page on the year 1844 in New Jersey. And we created across the state a really robust, multiracial, multi-ethnic, multi-faith-led people power movement around this effort. And we were able to get a piece of legislation introduced that was ultimately signed by the governor that restored the right to vote to 83,000 people on probation and parole, including my colleague, Ronald Pierce, who hadn't voted for 35 years, right? And it was a powerful moment. It became effective at the very beginning of the coronavirus moment. And so it was tricky because now 83,000 people could register to vote, but how can you register in the heart of a pandemic? You can't, you have to have a printer, an ability to print something. Registration was difficult. So we then quickly championed online voter registration. And online voter registration became effective in September. And so by the close of registration last year, more than 400,000 people across New Jersey registered to vote online. And there were a lot of dynamics, as you all know, very high stakes election federally and here in New Jersey, but it turned out that in part because of some of these policy reforms and because of this deep interest in the election, that we had the highest voter turnout in New Jersey's history last November. And I lift that up to your point, Layla, because I think that's an example of what we can do when collectively we lift our voices around a particular issue, when we build big movements that require our elected officials to really be accountable to us. Really quickly, one challenge in our advocacy, particularly because it's around racial justice, is that even in the advocacy, you see the real impact that race has. And I'll talk later about a more concrete piece of legislation I would love you all to help us advance. If every Black person in New Jersey, all of them, all 15% of Black New Jerseyans is behind an issue, name the issue, it's not enough to move in any state, including in New Jersey. That elected officials really don't take notice unless there is support beyond Black support. Very often, if an issue is seen as a Black only support, it gets pushed to the margins and it gets a symbolic nod or some other kind of lip service. And that's probably true. I think that's true of history more generally, that we really haven't had movements for racial and social justice that weren't, even if led by Black folks, multiracial in their scope. And that's also true of this moment. So the work for us is to engage folks who are, yes, Black, brown, and directly impacted, but also allies who will stand with us to advance this work. And by ally, I mean really stand with us, not the kind of allyship that says, I feel sorry for you, I watch you as you're in harm's way, but really the kind of allyship that says, together we're going to move forward to get the goal that we want to achieve, to provide this empowering peace into the community.
Yes, thank you for that.
Yes, thank you, Ryan. And Ryan, thank you for sharing an overview of policy. And Dr. Natalie, I'm wondering if you can share a little bit with us what people of color are experiencing right now. There's a lot happening. There has always been a lot happening in this country, but in particular in this moment right now, for people of color, mentally, emotionally, and physically, the very public violence against Black bodies and the justice system of response. Can you tell us what you are seeing and hearing from people of color?
Sure. I mean, I think the three words I would say is exhaustion, rage, and grief, right? Those are the three words I would say. And I would say that to watch the videos or read the headlines and have a daily assault almost every day of someone who looks like you or looks like someone you care about being treated as less than human is powerful, right? It is debilitating, right? And that I think, especially in a pandemic when the resources are so limited, like people are at capacity for a number of reasons. And so I think that kind of trauma is just awful, right? And then the rage, right, of, people have been experiencing this their entire life, right? And whether you are Asian or Black or Latinx, right? Just to see that what's happening in the collective community, because I think that people of color tend to view themselves as part of a collective rather than just an individual. And so I think when that happens to someone you've never met before, but they look like you, like that like touches your heart, right? And so I think that rage, that anger that either needs to be stifled or that doesn't have enough way to be soothed or heard. And I think the grief, right? The grief for 400 years of this continuing. And then I think with that comes, understanding that there are a lot of white presenting people who have had an awakening this past year, right? And on some level, that is wonderful, right? Because if they are enraged, perhaps they will help to support these policies that will really demand cultural changes. But there's also, I think it can be overwhelming for white individuals who are trying to be allies to try to seek their education by reaching out to people of color, right? And because the information is out there, right? And so I think it's that dance of there's just so much. And how do you make time for self-care? And how do you deal with all the other things you still have to do in life? On top of that, you have to be thinking about these racial issues. So I also want to just share a win, because one of the things I've been most hopeful about this past year is that I do a lot of anti-racism workshops and consultations, and I probably do like 3 or 4 or 5 a week. And Zoom is wonderful in that way. Like I do it across the country, and I've seen so many predominantly white organizations, practices, school districts really committing to these workshops, not a one-time workshop, but like a series where they're really building capacity to understand the historical context, to understand how they can be better allies, how to better support their BIPOC staff and the people they serve. And it's really heartwarming to see people more committed than ever to really do this. And I just really hope that that energy persists.
Yes, that active allyship, real work, real action. I would like to ask Lisa a question about health and medicine. Can you give us a picture of what racial bias in medicine looks like?
Sure. I'm really in the maternal child health space. And so what does it look like? It looks like diagnoses being missed. It looks like people not feeling listened to, respected, cared for. It looks like people turning away from sometimes the medical establishment because they don't feel respected or they don't feel valued. And it just, we have a saying, listen to Black women. When we think about the maternal health crisis, listen to Black women. When they say something is wrong, listen to them and believe them. We've actually moved from listen to Black women to believe Black women. And I always, we've all heard the story, but I say it every time. Serena Williams, the most recognizable Black woman, was almost not listened to. She wasn't. She had to really scream and shout and advocate for what she needed to get care when she had her daughter. And so we know things go wrong. We know that these things are preventable. We know that the establishment just doesn't treat everyone the same way. There's even been studies that have come out that's saying that there's a concordance with better outcomes if the physician is of the same race or ethnicity as the patient. And so that says a lot. I think that says a lot. We have a lot of work to do in this space, but that's what some of the consequences and that's what some of the outcomes are, unfortunately, around racism in the medical establishment. And we see it now as we've moved into this COVID vaccine. All of this distrust and hesitancy and some of the reluctance that people have is based on a history of racism in medicine as related to people of color. And so, we have a lot of work to do. I think as Dr. Natalie said, 400 years plus work to do to really unravel and unpack. And we have to just acknowledge that these things are real. They're not fragments of people's imagination. I work in the Department of Health Monday to Friday from, 9 to 5. But when I leave there, I'm a Black woman in New Jersey. And I myself, working in public health, has had many experiences, in quotes, in terms of, some of the interactions that I have had personally with some of the systems in which I interact in New Jersey. So it's real. It does happen. It's not something that people read about. And it unfortunately can translate into years of life lost or poor health outcomes or even death, as we've seen in the pandemic.
Thank you. And I think that is going to conclude our first portion with our panelists. And now, everyone, we are going to move you into breakout rooms. And when you get in your breakout room, you will have a YW, either staff member, board member, friend of the YW guiding and helping you with these questions. We have 2 questions that we would like you to discuss. The first one is, what does a public health crisis mean to you? How do you react to and identify with racism within the framework? And the other is, what are your calls to action? What would you follow up tonight's discussion through your work in your personal life. So how do you take this information that you receive from our panelists? We thank you so much for giving us so much to digest tonight, but we want to move this into action. And I know you guys are going to be giving us action items, but we want our attendees to also think about how they are going to take this information that you've already provided us and move it into their personal lives, into their professional lives. And so now we're going to move you into breakout rooms and you will have time to discuss this. We'll have about 15 minutes and then we'll come back for our Q&A.